You requested it and I read all your comments. Today, we're checking out the medical scenes and injuries from the iconic Christmas film Elf. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. Alright, let's dive right in. Nice, be careful. You know, I'm a New Yorker. I originally grew up in New York. I work in a trauma center. I see so many people that just get smashed. We call it pedestrian versus car. And so we just see so much trauma. You gotta be really careful. You gotta be paying attention. Oh, the gum, Steve. Don't do it, man. Don't do it. Free gum. It's so disgusting. Question is, are you gonna get sick? Most likely, you're probably not gonna get sick per se. There are different viruses that live on surfaces for X periods of time, but it doesn't last like weeks. Oh my gosh, I would get so dizzy doing this. And vomit, probably. It's pretty impressive he's standing up. It totally messes with, oh, there he is, vomit. I forgot that he vomits. We have these very specific anatomical structures in our ears having to do with our positioning in space. We're able to know where we are. When we start messing with that, it's called your semicircular canals, and they're in different planes with fluid in them, with nerve fibers. When you start messing with it, it actually throws off one of your senses to know where you are in space, and that's why you get pretty dizzy.
Okay.
Oh, nice. At the doctor's office. Don't eat the cotton balls, man. You always got to be careful when taking non-food particles in. They can actually form a bezoar, which is a collection of them into a ball into your stomach, and actually can cause some digestive dysfunction. Sometimes when people take too many pills at once, it does the same thing.
You gotta really hurry up, Walter, because I'm double booked the rest of the afternoon.
Am I sick?
Yeah, but that's not what we're here. We're here to do a test.
Come on, what kind of test?
Just a test to find out if you're my son or not.
I'm assuming they're doing some sort of paternity genetic test. So we do not do that in the emergency department. It's a send out lab, but that doesn't come back that day. Most labs in the emergency department are immediate. It's an emergency, right?
Why am I sitting on paper?
Because it's sanitary for the other patients.
The hospital that I work at has both. Sheets for patients that are in the bed for a longer period of time, and then when it's high turnover, it's paper.
It's cold.
Yeah, just please sit still, please.
They're using alcohol to clean the fingers, so probably like isopropyl alcohol greater than 70% to kill any bugs, clean the surface. We'll use chlorhexidine or betadine for different procedures that we're gonna do, but for something like this, it's pretty simple. We're only in there for a short period of time. We gotta be able to get in and out and get what we need done. Oh, it's gonna hurt.
Leaving pain days.
Squeeze, pop. Oh! We use a little lancet, and it just makes a little pop and goes in and out real fast. Squeeze the finger well enough, you minimally feel it. Just like when we would do it for like checking blood sugar. A lot of times people do it on the pads of the finger. You should actually try to do it on the side. That way you actually don't hurt your fingers when you're actually trying to use them and continue to touch the area where you've just pricked yourself versus on the side of your finger.
So?
Okay. All right.
It's a boy.
Yeah.
But he's your son.
They don't
Impossible.
They don't come back that fast.
The guy, he's certifiably insane.
So he came back the next day, 24-hour turnaround for a blood test. That's actually pretty good.
He's probably just reverting to a state of childlike dependency. An elf, what he needs is to be nurtured.
Nice.
You'd like me to breastfeed him?
Walter, just bring him home. Introduce him to Emily and Michael. And once he comes to terms with reality, he should drop the whole elf thing and move on with his life. I mean, that's what I would do if I were you.
So some people could potentially be delusional, so to speak. Sometimes people who are schizophrenic can believe, they are one thing versus the other. You have people who have split personalities. There are different other psychiatric diagnoses, illnesses that could play a part in this. Or maybe he just likes to be an elf. Or in this situation, he is an elf. Oh my gosh. Yes, that is so impressive. You ever try to chug soda? It gets like so bubbly and fizzy, like you just can't do it too long. Some people can like basically relax their esophagus and be able to open it up and down the hatch.
Can you pass the maple syrup, please?
I didn't put
Maple syrup.
spaghetti.
You know what? I think I have something. Yes.
Nice.
You like
Gotta
sugar,
find a
huh?
tree and get
Is there
your
sugar
maple
and syrup?
syrup.
Yes.
Then yes.
Yes. We don't need that kind of sugar in our bodies. When you have sugar, it's gonna make you crave more sugar.
We elves try to stick to the 4 main food groups: candy, candy canes, candy corns, and syrup.
I love it. Oh, that's so gross. Actually, I can't say that it's gross because I've never actually had maple syrup with spaghetti. Again, they all break down. Spaghetti, which is a simple carbohydrate, breaks down to simple sugar. Same with the maple syrup. You're gonna have a big spike in your glucose. Your insulin needs to kick in to be able to handle all that, and you're just gonna go super crash. Oh my gosh, what a good burp. Impressive.
Did you hear that?
He's even impressed with himself. If you are fully distended, full of gas, let it out, please. I understand society says we need to be nice and not belch and burp. Yeah, obviously don't make it like as obvious as humanly possible. Better out than in.
To the pit. I'll come visit you in a little while,
This is
okay?
so messed up.
I didn't know you had elves working here.
Oh! Oh, he's gonna be pissed.
Boy, you're hilarious, my friend.
There are a ton of different types of dwarfism depending on their structure of their bodies. In comparison to somebody who has dwarfism, depending on what type, they can live a normal, the same as somebody who is a full-size adult. One of the negative effects of dwarfism is typically the life expectancy is shorter.
Feeling strong, my friend? Call me Elf one more time.
Nice.
He's an angry elf.
Oh! Nice. Gonna drop kick him. Boom, nice.
Ow!
70 pounds, 80 pounds. He comes flying at you on a table with the legs up in the air. It's going to cause some issues, trauma to the chest. Could you get, a pulmonary contusion, cardiac contusion, break a rib? Yeah, potentially.
I wasn't ready for that.
Take some like Krav Maga. He's got some good techniques. This is a good example of somebody using force in different directions relating to using the body weight of the individual when they're in the fight to be able to overtake them, so to speak.
Call me Elf one more time. Call me Elf.
You're an elf.
He's gonna hit his head back on the wall. You can actually cause whiplash injury and actually a counter-coup injury where the brain sloshes to the front and to the back. And depending if your brain is fully expanded basically to the skull versus if you're older and it's shrunken down a little bit, you actually have some movement. You increase the risk of causing some rips of your bridging vein and your sinus tract, which then can cause a subdural hematoma. I love the movie Elf. I used to own it on DVD. I will watch it every year. My wife loves Elf. It's a fantastic movie and it's a feel-good movie. I loved doing this Elf React video. If you guys love this, please check out this playlist right here. I know you're gonna love it. And as always, please make sure you subscribe, turn those bell notifications on, and have a great, happy holiday and a happy new year. Thank you so much for watching and stay healthy, my friends.